Samuel was my wild big brother. He was adventurous, he loved to travel, he was crazy, he'd hang off bridges and wade to the furthest, most remote icy waters.
Samuel was crazy. He was also very motivating. We several times as sisters decided that we were not going to listen to him ever again because he always got us into extreme situations that were dangerous.
Samuel was a very loving, kind-hearted, very understanding, sweet kind of a husband. He was also a very proud father to Samuel Elijah, our son.
We live in a very remote wooded area. We've always had wood ticks. As a child, I had wood ticks all the time, that we were never freaked out about it. But I would have to say that in the last 5 years, there's been a huge boom in the amount of deer ticks we see. So deer ticks being the ticks that are known to carry Lyme's disease. So it was not very surprising when we started to think about Lyme's disease.
About 3 weeks before he passed, then we had a family get-together on the farm, and the plan was to go swimming because it was hot. It was beginning of July, and for old time's sakes, we wanted to spend the day in the river. When we went swimming, then that's when Leah noticed the rash, and I remember standing on the shore with her talking, and she's like, "I'm nervous about this, Justina. Like, there's something going on."
He was really kind of quiet and withdrawn. He said that he had the flu, and that was really odd for him because he's usually the life of our parties. And I mentioned Lyme disease to him on that day, but he just dismissed it. He said, "I haven't been bitten by a tick, so it's just the flu."
The week after, he had incredible pain, and he was taking Advil. Samuel never took Advil. Samuel never went to the doctor. There was never anything wrong with Samuel. And so I think it was during that time that maybe we wondered.
It was about 3 weeks before he passed. He was getting sore joints and had a big fever.
Rashes, strange rashes. Yeah. And it was his sister Leah suggested it in our presence at one point. "These are classic Lyme's disease symptoms," she said, and then I started thinking about it, and she was absolutely right. They were classic Lyme's disease symptoms, and I guess the interesting thing about it too was I had just sent tests away for myself because I was suspecting I might have Lyme's disease too, and his symptoms were faster and a little different. Had asked the doctor, could it be Lyme's disease, but the fact was he couldn't remember a deer tick bite recently. And the week after he passed away, my test came back positive.
I don't know when Samuel first noticed something was wrong, but I remember the day that he was driving himself into the hospital, he phoned the house and I answered, and he's asked if Mom was there, and I said no. And he just said, "Janine, I'm going to the hospital now because I just don't feel good at all."
I could tell right away he was very sick and in trouble. His heart rate was 42 and his electrocardiogram showed heart block. Taken together with the history of rash and flu-like symptoms earlier with exposure to ticks out of doors in Manitoba, we suspected Lyme carditis. We initiated antibiotic treatment against the bacteria that causes Lyme disease, Borrelia burgdorferi, and requested a serologic blood test to confirm the diagnosis.
At that moment I was going, "Oh, geez, I guess something really is wrong." But I didn't really know anything was that wrong until we got the phone call in the middle of the night that his heart had stopped.
About 12 hours after admission, he became sweaty and his blood pressure dropped dangerously low. The resuscitation team was called emergently to his bedside. His heart went into ventricular tachycardia and he required CPR and defibrillation. After this, the medical team was unable to regain spontaneous circulation. He was taken to the intensive care unit for treatment with ECMO, or extracorporeal membrane oxygenation, and a ventricular assist device was placed there to try to support his circulation and provide oxygen to his body. Our patient's case was surprising to the doctors and nurses who looked after him, because we are not accustomed to seeing such severe fulminant Lyme carditis cases, which deteriorate so rapidly, really within hours of presenting. It is a rare occurrence to see such a fulminant case. Nevertheless, I've gained a deeper appreciation for this possibility.
After Samuel's death, serologic or blood tests showed that Samuel had Lyme disease. For me, the most striking thing about Samuel's story is how fast everything progressed. Between coming into the hospital and his death was less than 48 hours. We want to make sure that this type of tragedy doesn't strike another young man or woman or another family.
I tend to focus on counting the numbers and monitoring the surveillance of the vectors, the black-legged ticks, or Ixodes scapularis in this case, as they have spread across our province over the last few years, and trying through monitoring that, trying to establish a risk parameter for the frontline physicians. Tick-borne diseases are not static, and with global warming, even here in a cold Canada, we're going to see the emergence of new diseases over the coming years.
I've not come to personal resolution over Samuel's passing. I don't think I ever will. However, I have come to terms with Lyme disease being a real danger to living where we live. My biggest takeaway is, yeah, I can make good choices. Like, I'm not gonna go rolling around in the bush anytime soon, but I'm not gonna bubble wrap myself, because part of living here is being outside.
I would like to express my appreciation to Samuel's family for helping us tell his story. We think it's important for clinicians to be able to see what happened to Samuel, so that they'll think about Lyme carditis when they see patients that present in a similar fashion.